All right, hi everyone. Thanks for joining us. Welcome to How I Got This Job, Public Health Program Manager. My name is Debbie Kaltman. I work at the Career Center on the Healthcare and Science Career Community team and also on our Employer Engagement team. I'm joined by my colleagues Betsy and Kyra. We're so happy to have you join us for How I Got This Job. This series is designed to introduce you to young alumni with interesting career paths. We want you to see that alums can really help you in your job search, help you expand your network, and that they might just be a couple years out of college or graduate school. So we hope that you'll learn more about career paths and jobs that you might have in the next couple of years. Like I said, we are recording this event and we will share the video afterwards. After this, Kyra's going to give a little bit of an overview of some of the other programs and services we have through the Career Center. Then we'll hear from Selena, and then we'll do a question and answer time. And at that time, if you have questions, you can unmute yourself, you can send it through the chat, or if you would like to ask a question anonymously, you can send a message to me or to Betsy and we'll ask it on your behalf. With that, I am going to turn it over to Kyra for just a minute.
Hi, everyone. My name is Kyra. I'm the Healthcare and Science Career Community Ambassador. So I do advising appointments and I reach out to student organizations here at the Career Center. So today I will be just showing you what resources the Career Center has for you and how you can take advantage of all of these resources. So first, we have the Alumni Sharing Network, or Alumni Sharing Knowledge Network, which is where we found Selena. So this network has a wide range of all of the recent alums and everybody that wants to talk to you. Their jobs range from public health program manager to somebody in the data science field, for example. So it's a great resource to take a look at, poke around, see if any recent alums pique your interest. And if they do, you can reach out, send a message, ask them about like their DePaul experiences and how they took advantage of all the resources that DePaul gave them and how they got into their field and how they're successful in their job. So it's a great place to start networking, be a great place to meet recent alums and get to know them a little bit more. And then we have the Career Center. This is our main page. We have the career chat, live chat here, which will help you connect with someone who works at the Career Center just for like a quick question, or if you want to have a quick question about where to get your resumes done, et cetera, et cetera. We have the Career Library here, which is a bunch of resources that can help you with your resume, with your cover letter, interview tips, networking resources, salaries, anything under the sun dealing with careers. It's a great way to, if you don't know how to do something, you don't know what a resume is or what a cover letter is, it's a great way to get an introduction to the resume and cover letter world. Next, we have advising appointments with me and Betsy. So we can help you anything from reviewing cover letters, reviewing resumes, reviewing a personal statement, or having a mock interview for if you're interested in pursuing professional studies or just preparing for a job interview. So this is us right here. It's a great website to just poke around a little. And then next we have Handshake, which you may or may not be familiar with. Maybe it's how you signed up for this event, or maybe you've scheduled an advising appointment before with us. But another great thing about Handshake is that it also acts as a job board. So you can look at recent job postings that are up, any internships that you might be interested in. You can bookmark it and save it for later, like I have here with this research intern from the University of Chicago. It's a great resource to just keep checking back on because there might be new job postings or new internship postings. So it's just a great resource just to have another job board handy for you. And then lastly, or no, sorry, not lastly, we also have UIP courses. They might also be known as CLD courses. Let me see if I can find it. But if you go on Campus Connect and look up CLD courses, there are a range of courses that can help you with your career development skills. So I know I took one in conjunction with my internship, and it helps me make the most out of the resources, the people I met, and networking and stuff like that. So it's a great way to get college credit, and it's a great way to just have an extra class and have time set aside to learn more about your career toolkit, learn more about your personality and how that could help you in your job. And then next, if you want to join the career community, so HCS, we have bi-weekly newsletters that go out with events that are happening in the Career Center and interested job listings. Feel free to join the career community and get an additional resource to help you out. And I believe that's it. Let me pause.
Yeah, I put in the chat, we also have a LinkedIn group that we would also love to see you. We share jobs and internship opportunities, events, career tips, and more.
I will pass it back over to Debbie.
Awesome. Close. Yeah, there we go. Fantastic. Thank you so much, Kyra. Now it is my pleasure to welcome Selina Sepulveda, a double demon, joining us today. And we're going to learn more about her current role, her undergraduate and graduate experiences, and how she got to where she is today. So first, Selina, if you could tell us a little bit about your undergraduate time at DePaul. What did you study? What activities were you involved in, on campus, off campus, and how you explored the healthcare field?
Okay, perfect. Yes, and thank you for having me. So for undergrad, I started as undecided, and then I changed my majors a couple of times. I was trying to figure out what I wanted to be and everything. I started as undecided in art history, then psychology, and landed on health sciences. And I definitely, all the activities and jobs I had, I felt paved my way to like my career and everything. So I was very involved on campus. I was in the fraternity, or community service organization. I was also involved with, I worked at the Rays and health promotion. I was a part of like the neuroscience club. I was a part of, I did like some service immersion trips. I volunteered a lot in the community. So I selected DePaul as my college because they're very big on giving back and working in the community. So I was always like volunteering at the church with the soup kitchen, or volunteering at like marathons, races, or always like seeing what the community had to do. So kind of learning more about Chicago and seeing people impacted by disparities and inequities, like turned the light bulb on for me that I wanted to make an impact on people. That was kind of my career moment. I was like, I need to do something that can help others and better other people in like the country, or at least the city. So that kind of made me go towards health sciences. And I was thinking physical therapy would be the best route to do that. I was exposed to, when I was doing my capstone or doing like my internship class, I was working at Athletico. So that was a good opportunity to see patients up close, to learn more about healthcare. And when you're mentioning Handshake, I remember those doing Handshake, like using that to like find jobs. I worked at Athletico. I also worked at a speech pathologist office and did a lot of healthcare, looking at insurance and things. So yeah, Handshake definitely works. Yeah, so those kind of opportunities helped me learn about my career for healthcare.
We love to hear a handshake success story. We did not pay Selina to say that, but no, we're happy to hear that. Can you tell us about your application process to grad school and how you decided to pursue your MPH? Yes. Or Master's in Public Health?
Yes. So graduate school was very daunting. It was very overwhelming. So I'm the first in my family to go to grad school and to even think of doing grad school. So it was very overwhelming. I leaned a lot on my advisors. And so it was really great to have DePaul and the health sciences team, because I was like, how do I do this? And also when I applied for college, it was paper. So it was, so even doing stuff like online things and like doing like, it was a lot easier to do like the graduate, like just one application goes to all the schools. So that was nice. But trying to figure out like how to do supplemental material, how to get recs, how many hours you need of like clinical. I had to like volunteer a lot at local hospitals to start getting my patient numbers increased. So you had to do like 500 hours or like some crazy numbers of like patient contact or volunteering time. So just trying to make sure all those requirements are done. Initially, I was thinking physical therapy for graduate school. So I had to get all those prereqs done, make sure everything was ready in order for grad school. And I applied to a bunch of programs. Unfortunately, I didn't get into PT school, but during the same time, I was also taking my capstone classes, so taking my health sciences classes, and learned a lot about public health. So I never heard of the word before. So it was great to learn about public health and to start seeing like how everyone in public health was dedicated to impacting the community, not just working with a patient, but working with the broader population and making big change for everyone. So I definitely like that, learning from my professors who were in the field and seeing what they were doing, and especially working in Chicago. So DePaul has a master's level program for public health. So it's great to hear about the program from professors and then to see that they would be in that program as well. So I applied directly for DePaul's program. That application was a lot easier because I've already applied for a bunch of schools. So I kind of knew what to do. I had my paperwork already. So, and I got into that one. So I started right after undergrad, started grad school.
All right, and can you tell us about your experience in graduate school, like what kinds of classes you would take to study public health, any internships or jobs, and especially about your capstone experience?
Yes, I loved grad school. It was my best time at DePaul. So basically, it's a small cohort, and it was community like was my specialty within public health. So it's great to have that community health aspect to it. But I was also working with people who were like-minded, who were passionate about working with people, or passionate about public health. So in undergrad, you're kind of mixed with a lot of different kind of people with different interests. So it's great to have that the closer group in the cohort. And then also I've been working with these people ever since grad school. So Chicago is a big city, but a small healthcare world. So I feel like everyone I'm still working with, I still have at least 5 colleagues or 5 peers from my cohort that I'm working with now in my role. And grad school was built to let you allow you to keep working. So I needed to work full time to pay bills, pay rent. So it was nice to work at my nonprofit during the day and then work and then do grad school at night. So it was only like, I think like twice a week we met for classes. And it was like fun classes. So you're learning about things you want to do. So I'm learning about like grant writing, learning about data. So learning about like SAS, doing a lot of data analysis, learning about public health, intro public health things. So it's all in every class. I feel like you're increasing your resume. So you're learning tangible skills that will help you for your future. So like grant writing skills is essential, to be able to work with data is essential, to data entry, to even like use Excel or SAS was very helpful. So those kind of skills. Also, you always have to be involved and to kind of keep growing your resume as you're working, even with like grad school. So I was also interning at the AIDS Foundation at the time to learn more about HIV work, preventative work. And I was also working with the Center for Community Health Equity, which is the partnership between DePaul and Rush. So they had a research collaboration, which is great for grad students to take part in. So I was doing a lot of like research and interviewing med students, learning about their work. And it was a great opportunity to work alongside our director and to get research skills, but also be able to present our work and work in conferences and work on articles and things. So it was good exposure for the research world as well. And then second year for MPH, for most programs, it's going to be 2 to 3 years. Depends on what level you want to do or how many classes you want a year. So it was nice for DePaul because it was like, I did it in 2 years, and the second year was all capstone. And it was also very appealing that DePaul links you to your capstone site. Some programs, they kind of send you off and you have to go find your supervisor, find your experience, which is good and bad. But for DePaul, it's very nice that they have a lot of networks. They have a lot of alumni who want to help students and want to be their supervisors and their mentors throughout the capstone experience. So I was able to work alongside Chicago Public Schools and to work with MPH alumni who was my supervisor, and she knew all about the program. She knew about like where I was at and everything. So it was a great mentor to have. And I was placed within their health and wellness team at CPS. And it was like, I heard of public schools. I grew up in the suburbs. I didn't really know what public schools in the city meant and what they looked like. So it's great exposure to see students, see what resources they're given, because there's so many inequities in the city. It's great to have the city provide resources to students and families through school and to get them like doctor appointments, eye doctors, a variety of things. So I was doing the evaluation side of their diabetes program to make sure teachers were getting prepped with the right equipment, the right knowledge to take care of their students who are diabetic. So it was great to learn about health topics and health issues, but also gain evaluation skills, to learn how to build a survey, to learn the importance of data and how it's used in programming. So it was a very effective 9 months program and like internship. and to also like make connections, networking like every day there, and also gaining a lot of skills.
That's great. I think we always talk about how important it is to grow and expand your network. And I think it sounds like you really took advantage of that during graduate school, and also that you were able to work full time, go to graduate school, intern, work on research. I imagine it was a very busy 2 years for you.
Yes, I guess I like to be busy too. So yes, always busy,
Yeah.
connections. Yes. And I still talk to the MPH, like directors over there, always connecting with resources and work with students. So it's great.
That's fantastic. Well, tell us about your first job after graduate school, kind of what you did, how you got that job, and what kinds of connections you made.
Yes. Okay. So graduated in June, and I was kind of scrambling as like a lot of people who are like graduating, trying to find a job. I applied to a variety of things. This time it was a lot easier than undergrad, because I felt undergrad I was applying forever and had to wait for a response. But after applying with grad school, because now you have a couple more letters after your name, it's a little easier to find jobs. So it was nice. So I selected a job with UIC. So within the campus for UIC, they have a medical district. So I was working with their College of Medicine and doing evaluation work. So similar skills that I learned within my practicum with CPS. So I was able to use those skills, and my my supervisor at CPS was able to recommend me and really push for me, advocate for me that I was able to do the work. And it was great to be like funded under a grant, learning about CPS. I was working with students and recruitment, but also working with their pipeline programs. So essentially, a lot of schools, a lot of universities will be helping high school or college level students learn about healthcare careers, get them into programs, and help them launch their careers, and give them support resources to be a healthcare professional. So I was working with UIC's program that does that, and evaluating, so making sure the program is working, make sure it's effective, making sure that students were having a voice and getting their feedback in all the programming. So using a lot of my evaluation skills and grant writing skills to use that role. So I was an evaluation manager when I started at UIC. So it was a great opportunity too.
And then how did this role help you get to your current role at Lurie Children's Hospital?
Yes. So at UIC, I was there for, I want to say about 2 years or so, because it was a grant funded position. So a lot of the work in public health is grant funded, and things do change quickly if you don't get funding, or if you programs end, programs start. So it's always kind of a messy situation. Sometimes you always have to like be adaptable. So with UIC, their grant funding was ending. So I needed to find like my next step and everything. Luckily, I'm all about networking, as I was saying. So I made a lot of connections through other people who were doing similar work. So at UIC, I met my current boss, my director at Lurie Children's, and we were partners. We were collaborating with students, collaborating with work already. So it was very natural to be, once I was done with that position, she wanted me to join her team. So it was great to move over to her team. I already knew what to do, but essentially at UIC, it was very small scale. I was working with one program, 20 students. At Lurie, we have 16 programs, 400 students a year. So it was very big scale of the program, but it was great because now I'm working with evaluation work and continuing and growing a lot of my skills.
Well, speaking of that, tell us about your current role and kind of what kinds of areas you work on, and then what a typical day or week or month looks like for you.
Yes. So right now I'm the program manager at Lurie Children's. So like I was saying, so our department name is Mentorship and Workforce Development. So we're within the Magoon Institute, which is like the public health arm of the hospital. So we're doing a lot of work in engaging students, primarily in the Chicagoland area, or Chicago like urban area. So we are working with high school and college level students to re-engage them and ideally diversify our workforce. So we're working with underserved neighborhoods and bringing students in to give them resources, give them access to healthcare careers. So if they don't know how to get to grad school, like I didn't know how to get to grad school or learn the pathway of careers, we're helping them get support, give them job trainings. So all these programs are giving them workforce development or healthcare career education. And then my job is still do evaluation. So I'm building survey tools, evaluating, collecting data on the programs from the students and from departments and from other partners to see if the program's effective, to see what the impact is, get quality improvement so we can keep growing and making it better each year. And then I'm also doing like the grant writing, working with funders to make sure we secure all of the program funding. 100% of our work is philanthropic. So we have to make sure we recruit, we get all the money, we get all the funds we need to support students, to address any barriers they may have with coming to our programs. So we do a lot of that, and I do a lot of logisticals, like the budget. So also looking at that, making sure our small team has everything they need, programs are running smoothly, and any other things that may come up from like students needing access to resources, students needing a letter of reference for something. it's with the nonprofit world, it's you have to be very adaptable. So whatever is needed, you have to jump to it. Sometimes we're like, this summer we were making boxes for our program. So we were on the floor in the parking lot of FedEx, just piling boxes together, making packages, shipping off to students for their program material. So sometimes it's very, you're on the floor doing the work. Sometimes you're in a nice office doing the work. This week has been very different. Like we attended a conference, so it was very nice to talk about our work. We were able to go out and actually like disseminate our numbers, talk about data, talk about the impact of our work. I'm also like always engaging our alumni, trying to get them into like job career trainings, get them into employment at Lurie, so make sure that they come back to Lurie is our big goal. And sometimes right now we're prepping for our busy season because we have summer coming up. So we have 100 students coming into person for the hospital programming. So we have a lot of like interviewing students, onboarding them, making sure they have their COVID vaccines and everything. So it's a lot of day-to-day things, but I feel it's very fun to kind of always have something new happening, always using a variety of skills each day. And the best part is working with students and just seeing them like get excited about their future, get the opportunities they need to help them and their families. So yeah, a wide variety of skills I'm using each day.
And where would you like to see your career go in the future?
Oh, that's awesome. Hopefully still working at Lurie's. I really like working with Lurie's, and it's like a great foundation for the work that we do, because they do have that public health arm. They do work with children already, so it's great to keep working with students in that capacity, and hopefully just keep growing in my career. So right now I'm a program manager, hopefully being a director one day, or do the next level, or even a senior manager, just keep growing in that direction. But I do like the logistical side of programming. So I do like working on grants, working with budget, working on like submitting invoices and things. So maybe growing in my operational skills would be great. And then hopefully still working with students though. So if there's a way to kind of keep those two together, that'd be great. Yes.
Thank you so much, Selena, for sharing your story, for sharing your experiences and your time with us.
No problem.
We're going to open it up to questions from the audience. So again, if you would like to unmute yourself or ask a question in the chat, or you can send a message to me or Betsy and we will ask it on your behalf.
Hi.
Hi, how are you?
It's been a while after seeing you during our basketball event.
Yes, so she was actually our student in our program. So yeah, I know her.
It was really fun. I came with my husband and we were almost lost.
Yeah, so we are also grantees of the Chicago Bulls. So we got Bulls tickets. So we were able to take our students out for a game. So it was awesome.
It was fun though. But it was great, hearing you speak about your experience, and it's fun. You have a very, very good energy. So
thank you.
So thank you so much for sharing that. So I have a question about your job transition. You mentioned you were working as an evaluation manager at UIC, and how was your transition from that role to your current role, being a program manager at Lurie's?
Yes, so it was the one thing I guess I left out is that because the grant funding ended, or like for UIC, I had to go to like the 4-month kind of job. I had to go to the YMCA for a little bit, and just to kind of fill the gap. And then as also HR takes a little bit of time, because I was hoping to get a job at Lurie earlier than it took, but it took a little bit of time for them to secure a position, make a position, and create everything for me. So a lot of like patience, I guess, and hoping that it would work out. And also it's great to have those networking skills, because you've met Maria, but my boss, is very nice to kind of make those connections beforehand. So really networking and showing that you have an interest, showing that you have these great skills that you can contribute to a team. So I think that really make an impact, that like she liked me through my previous roles, so that she was able to prioritize creating a job and then advocating to get me over there too.
Yeah, that's awesome. So how did you build your confidence? Because I know the job roles definitely differs from the evaluation, and the program manager job roles and responsibilities are different, and you'll have to have like additional responsibility, juggling between writing grants, managing other projects. So how did you develop that confidence?
It's very hard, especially being like, I'm Mexican and Puerto Rican, so I do not fit always in a lot of my meetings, and I'm always like one or very few brown person in my meetings. So it's very hard, because you already know you stand out, you're different. So also coming from UIC, where we're very big in like the West Side, but Lurie's next level. It's very bigger, very like more well-known throughout the state, throughout the country. So it was very intimidating coming to like a big fancy hospital. So yeah, I feel in the beginning, I was very nervous, but I had to keep telling myself like, luckily I'm the only evaluation person. So I'm the only one who knows how to do this. I'm the only one. So like whatever, like all the skills I have, even though people have been doing this work for 20 years, 15 years, like I'm the only one who does evaluation. I know these programs. So you had to kind of keep building yourself up. And if you do make a mistake, you kind of lean on that. And my director is very approachable, very like friendly. So if I do make errors, she talks to me about it. It's never like a horrible thing, because you will make mistakes. But as long as you keep having the perseverance to keep going on, keep pulling yourself up. And also, I mean, like I would have to say, like you earned this degree, you worked hard for this, you do have this. So I mean, that was like another proof of like you deserve to be here. So it is very hard sometimes. So even like when we go to conferences, like still trying to be like, I know evaluation, I know public health, it's like all these doctors and all these other big names. But yes, you can do it.
Yeah. So yeah, because I'm interning at Sinai. So I am currently working with two of their projects with the Health Equity and Research Assessment Team team. So
Very cool.
we do manage projects linking with the Lurie, with the employee professional pathway. So I kind
Yes.
of know what's going on. But sometimes I feel anxious because I kind of know what they are talking about, but I know the answers. But being in the bigger team, it's hard, feeling a little hard to come forward and talk about what we know. Like that took great portion of me to come forward. So yeah, that how do you ease that anxiety?
Just don't be afraid to be wrong, I guess, because I was always that kid in high school who didn't like raising my hands, because I'm like, oh, I know the answer, but I don't want to, but what if I'm wrong? So I feel like I developed that better in college, and now in like my meetings, I talk a lot more, I like engage people. So I feel like just it's okay if you're wrong, because then someone else is going to be in the room to help you. Or if it's okay if you don't know the words, you don't know what's going on, you can ask questions. And I mean, like, sounds like you do know this material, so you probably are in the right way, you do know what's going on. So definitely it's just gonna take some practice of like being advocating for yourself and voicing your opinions.
Thank you so much. That answered a lot of my questions.
Yep.
Also, one last question.
Mhm.
So right now I am working in a different department with health equity research, but I'm also interested in working with other areas such as maternal and child health, or domestic violence, or different parts of the social issues within my scope of field. So is it hard for the transition, the onboarding and everything, or I just want to know,
You mean like the applying wise, like applying for even the job, or just like when
applying
you're
and working?
okay, so
Applying
for
and
the
working.
applying wise, make sure your resume has those transferable skills. So make sure if you're looking for a new research job or a new topic in research, make sure you're pulling all those experiences that you have that match that job, so that they can link that up perfectly. So they don't have any like questions of like, I don't know if you can handle this. It's not work you've done before. So make sure that it mirrors what they want exactly. So that's easier for that to work out. And so when it comes to your new role, if you do need questions or need more background information, you can usually find it online, or if you can ask your supervisor to kind of catch you up to the new topics and everything. But they will you to have like an adjustment period. So they're not expecting you to come in and to know everything about your hospital or everything about your new job. So there will be like, I feel like at least a couple of months of you just catching up and learning and kind of sitting in meetings, observing everything. So that's definitely understandable for a new job. They don't expect to know everything in day one. You will have
the onboarding process, so they'll give some time for understanding
like organizational
the
level, but also
workflow.
your director will let you know what the new role would have and what your new task would be.
Thank you so much for
And I'm glad you're in
patiently
healthcare. That's awesome. I'm glad that you're working at Sinai.
thank you so much. We'll connect soon. Thank you, Debbie and Betsy and Kyra. Thank you so much for the opportunity.
Yeah, thanks for joining us.
Great questions. Does anyone else have any questions for Selina? I have one, Selina, that I'm curious about. How has the COVID-19 pandemic impacted your work broadly, and also just like on a day-to-day basis?
Yes. So our programs were usually held in person, but the last 2 years, everything had a transition to virtual. So like I was saying, to be very adaptable. So my job in 2020 then became to learn everything about Zoom. So I had to learn about like Zoom, talk to Zoom reps, how to figure out how do I make a classroom, how do I make an online site for students to have resources. So I became like the tech person for our team. So even though that's not in my job description, I took that on because I guess no computers, but yeah, so I took that on and we became like the Zoom person. So it was great to learn that. And then we were able to, because we still wanted to provide a program for our students, a lot of hospitals didn't have capacity because they were overwhelmed with patients. But luckily in the beginning, we didn't have many COVID patients because it was impacting the adults population more. So we were fine. Our team was equipped, we're not clinical, so we were equipped well to support like students still. So we were able to continue our programming and we even expanded our numbers. So typically we take 100 students in the summer. We took like way over 100, or we were able to like take a lot more students in the school years as well because it was virtual. So from a budget stance too, it saved us a lot of money because we didn't have to pay for food, for venture cards. It didn't, we had to have the barrier issues of some students not having computers, but luckily CPS would be able to provide students with computers or Wi-Fi, but we didn't have to deal with the transportation barriers, which usually students coming from the far south side couldn't come to our programs because of the commute and safety reasons. So that was nice for us to expand our program to reach other students. So some pros and cons, but yeah, definitely being adaptable to learning all about the virtual space. But because it lasted so long, we were able to continue programming for 2 years, and now we're slowly going back to in person so that we can keep doing our work. And then from grant writing and things, we did have more opportunities from like the city and from the state to look for funding that would support us through COVID times and support us for like virtual funding and things like that. So that was good. And we were also still able to present in virtual conferences. So it was a good opportunity still to keep doing what we're doing.
Questions that folks have. And again, you're welcome to unmute yourself. You're also welcome to put questions or thoughts in the chat.
I'm curious, I know you talked a lot about networking and the power of networking and how you have got jobs through networking. What advice do you have for students for networking if you are maybe more of an introvert or you're not sure, or this is a new concept for you? What advice do you have?
I am an introvert, even though I like talking. I feel like I'm with an extroverted introvert. Like you need that like time to then recharge for the next event. But yeah, so I feel like I was very nervous doing networking events in undergrad, but DePaul hosted so many networking events. It was great. So I felt like the first time I think I went to a lot of DePaul, like your career center kind of events that would have networking events. So I would go to them. I think I went to one, I didn't talk to anyone. Like the first one, I just went there, kind of check it out, see what it was about. And I was just like, I don't know if I can do this. So I think the second one and like the ones after that, I actually started engaging people and I would just kind of like start reading name tags, like, okay, where are they from? Sometimes a lot of business heavy. So I'm like, okay, I don't know if I can talk to them. Or sometimes I would just practice. And even though like their career was not a direct impact or like direct correlation to mine, I just talked to them anyways, just to kind of practice and get my nerves out. And then that can help me talk to the next one a little better. So I just say like, yeah, keep practicing. And I just did a lot of the DePaul events because I felt like a safe space to at least try. And then these alumni that are getting pulled to and invited to the events, they already want to do this. So they're already coming in ready to talk to students. So I felt that was a little easier than just going to like a Chicago alumni or networking event where it seemed like who knows who's coming to these things. So I felt like the DePaul one sounded a little safer. And then going to like, then now like my level for like conferences or going to even like partner meetings and things, I feel just trying to smile and talk to people, even just talk about like how is their day or how's their program, kind of putting the focus on them. People like to talk about themselves. So just asking what they're doing, how's it going, then that kind of break the ice and you'll find a connection somehow.
That's really helpful, Selena. And this is one of the reasons why we love to bring back DePaul alums like you for our events, because I think that when you're like starting off that networking, knowing that you're talking with someone who has like a shared experience, like at the very least, like we have DePaul in common and it's something kind of like you were saying that you can like break the ice with and so forth. So that's a really fantastic tip. And I love hearing about how you've really like developed those networking skills over time, because I think it is something that doesn't necessarily come naturally to a lot of us.
Definitely.
Any other questions? All right. Well, not hearing any more. Selina, thank you so, so much for joining us today, for sharing your story, for all of your wonderful insight. Thank you to everyone who joined us today. Like Debbie mentioned, we'll be sending out a copy of the recording, and I hope everyone has a wonderful rest of the day and a wonderful rest of the spring quarter.
Thank you.
Thank you.
so
Bye,
much.
everyone.
Thank you so much.